In today's class, we will study case control study. What it means by case control study. By the name only, we can understand that the case means here we are taking in the medical research the patients, the ill persons, and control means healthy persons. And study means that we are doing some research in that we are comparing the two groups of peoples to understand the why the disease is occurred, what is the causative factor for the disease we are trying to find out. Now what is the role of researcher here? In this case, the researcher is only, he should observe, he should not intervene in the any their work, just observe and that collect the data, record it and analyze it. This much work is only. While the doing this study, we have to take two groups. One is case group, in that the disease is there, the illness is there. Another is that the healthy volunteer. Those are almost similar. It means that in their age, sex, or their area, almost similar should be there. That we are comparing and trying to analyze the why the particular thing is happening. This is about the case control study. Now the definition, what it means case control study. A case control study is an observational analytical study. Means the researcher only observing and analyzing this in the study that compare the people with disease. This is nothing but cases, to those without disease, the control group, to identify the process risk factor. Here the two groups of people, one group is the disease group, that is called case group, another is the control group, healthy groups. We are comparing here in this study and identifying the risk factor. It means that what is the cause for the disease. Okay, we can take example, that is lung cancer. Whether it may be due to the smoking, or either whether it may be due to the pollution, or it may be due to the any chemicals, or it may be some other factor. We are trying to find out the what is the risk factor, why the disease occur. Here what we are doing in a particular area, the two groups we are making, one is healthy groups, another one is the disease peoples. Now the second steps is the objective, why we are doing. A researcher why should do case control study? What is the objective here? To identify the association between disease and exposure. Here the identify. Okay, you consider here exposure means it may be exposure, maybe smoking or chemical industry smoke or pollution, anything it may be, exposure and the disease. Okay, due to this exposure the disease is produced. That identifying the association, is there relation, is there in between two things, that we are trying to find in this case study. Now how we have to do while conducting the study, what are the steps we have to do in the research, in the case control study. The third step is steps in the study design. The first thing while we are doing the study, the first select the cases with the diseases. You have to first think, whenever you are doing study, the first thing is you have to select the cases in which the disease it is there. Suppose the lung cancer, you have to collect the diseases. You may take 10, 20, 100 patients, that you have to select the disease, those patients. And in the second group, select the control groups. It means that those should be similar, their age, sex, area, everything, the place, location, everything similar, but those people should not have disease. This is the two things we are comparing. Third is collect the past exposure data. It means that we are gathering the information from these two peoples. Why the disease in this case, why the disease is not in this, what is the difference in these two groups, we are trying to understand. Okay, we are collecting the information. This is the third stage, collect the past exposure. Next is the analyze using odds ratio. Here in the fourth steps we are taking the one formula. That formula is called odds ratio formula. With the help of formula, we are analyzing the two groups and understanding the why the disease occur. The next fifth step is interpret the result. Why the disease result is occur. The final result we are trying to understand, interpret, and account for bias. Is there any one-sided result? It is there. That also we are trying to understand in these things. Next, the formula is, that is odds ratio is equal to AD by BC. What it means by A? A means case with exposure. Already I told, case means disease persons, that is not healthy, that is we discussed. Disease means case, the disease with exposure. Okay. Next one, B, the control, healthy persons with exposure. C is the disease person without exposure. D is control without disease, without exposure. Four things we are collecting and filling in the this formula. Odds ratio is equal to AD by BC. While interpreting, how we have to understand means over odds ratio is more is equal to 1 is nothing but there is a no association. It means that suppose the chemical industry it is there, you are analyzing. It means that due to the chemical industries, the odds ratio is came 1. It means that there is a no relation between that chemical industries and their disease. The odds ratio 1. Odds ratio is more than 1, it means that the exposure may be risk factor. Okay, due to their smoke or of that chemical industries, due to the pollution in the environment, the exposure may be risk for that disease like cancer. Like that you have to consider, if more than 2 means it is the twice double in the chances of the risk odds ratio. If OR is odds ratio is less than 1, exposure may be protective. It means that there is a no chance of this exposure, there is a no chance of the disease. You have to consider the calculations we will study in another video. In this theoretical class we will understand this much only in today's class. Okay, this is the interpretation method. OR1 is no relation between exposure and disease. OR is more than 1, it means that due to that exposure, due to that cause, the disease is produced. OR is less than 1, it means that there is a less chances of the producing the disease. This much we are studying due to the interpretation using the OR formula. Now what is the advantages? As a researcher, if you are doing this case control study, then what is the benefits? What is the advantages here? The first one, it is a quick and cost effective. You are doing very fast and little money it requires. Next one is the good for rare disease. If the diseases are very few diseases in that village or in particular area, you can easily do it. And next, you can assess multiple risk factor. It means that multiple risk factor means that if while doing only one study, you can analyze the multiple factors. Suppose just now I told that is the due to the chemical industries, the cancer is produced in that area. It may be chance of smoking, it may be chance of some other air pollutions, it may be chance of some vehicles due to that pollution it is coming, that may be chance. So many other factors it may be there. Okay, that also the multiple risk factor in single study we can assess in this case. This is the advantages of this case control study. Now the limitations. What are the limitations of this case control study while doing the study? The first one, recall bias. It means that whenever you are asking for the participants, the diseased persons or healthy person, they may not come. That's due to that the one-sided result will come. This is the recall. Selection bias. This is the very common. You are not properly concentrated. It's randomly you are selected the patients. You are not selected properly. The healthy persons you are considered as a disease, or disease persons you are considered as a healthy. Like that, if you are doing the bias, then also the result will change. The next one, cannot calculate incidence or risk directly. It means that suddenly new cases are came, or any risk, direct risk are there. There is no chances here in this study. The next one, example. Lastly, that we will study the example, the lung cancer cases versus healthy control to assess the smoking history as a risk factor. Okay, just now I told is there any chance the risk factor is the smoking? Lung cancer is the disease. Is there association? It is there, that assess the smoking through this case control study. those who are smoking group with the non-smoking groups. We are comparing and we are analyzing that whether the smoking groups in their chances of the disease are more or not. Like that, we are comparing and finalizing the chances. Okay, like that, this case control group of study we are doing. Okay, hope you will understood this case control study. If you understood, please like, share and subscribe. Thank you.